you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join doctors Joanne and Erin as they rewrite the rules for women in medicine. Let's begin.
At the time of this recording, the World Cup is happening. 32 nations, thousands of the most elite athletes on the planet. And every single one of them has not one coach, but many. A performance coach, a technical coach, a mindset coach. Nobody questions whether those athletes deserve the level of support. Yet, physicians, people who trained just as long, sacrificed just as much, and make life and death decisions, don't have that. Coaching in medicine isn't standard. It's not even expected. For physicians and healthcare organizations alike, it's not on the radar at all. Today, we're asking why and what can we do about it. And I am joined today by my super co-host and colleague, Dr. Erin Hurley. So let's get straight to it, Erin. I love how you use the athlete analogy a lot in your trainings. Talk to us about it. And what's that parallel between training as an elite athlete and training as a physician?
I began using the analogy of the Olympics several years ago, and now we have the World Cup is in our faces on a daily basis at the time of this recording. And as I think about elite athletes, as Joanne said, they all have coaches. Nobody shows up to the World Cup. Nobody shows up to the Olympics. Nobody shows up to a professional football game without a coach. And when I think of how many years we've trained, how much sacrifice we made as physicians, how much we had to postpone, and how hard our jobs are, right? It's not for the weak at heart. And there's a significant weeding out process. And what support is there for us? And it's almost like the opposite, where we're taught to be extremely independent, not ask for help, not set boundaries. And so for, elite athletes during high school, they might not be going to school. They might be, having different types of schools specifically trained to support them to become that elite athlete that they want. And in medicine, it just isn't the case. And yet, even for Little League, we're not asking those kids to go on the field and play, ball without a coach. And yet it's such a foreign concept. And I know I hired my first coach in 2017. Joanne, I don't know how far back you went, but I did it going on a leap of faith, blindly, knowing no one else who was getting coaching. Some of the research wasn't even out yet. And for whatever reason, I just knew it was the right thing to do. I'm glad I trusted my instinct. And yet I think I'm still the only physician coach. I became a coach back in late 2020 or 2021. And I don't think there's any other physician coaches in the area. It's not adopted by most clinical practices or hospital systems, even though it's been shown to help. And so, so I think that being a physician does have lots of commonalities with elite athletes. And yet we don't have the same support, even though I think that doing healthcare is a little bit more significant and onerous than playing a professional sport. And so why shouldn't that be part of the normal training and even from the beginning as medical students? Because as you and I both know, I think it's only 6 months into medical school where the mental health starts dropping down into having similar levels of concern as practicing physicians. It doesn't take long at all. So,
yeah. And even in business, we know that a lot of high executives hire coaches and they see it as an advantage of, if I can, why not? Right. And that's how we think about it. If I can be better, why wouldn't I get help for that? And yet what I hear a lot, and I'm sure this is what you hear too, is no, I'm fine. I don't need it. And and I think I have a little bit of added filter being a psychiatrist. And then because sometimes I hear that same hesitance and almost stigma that I hear when people kind of reject psychiatric help. Like, no, I'm struggling, but I'm not that bad. Like, I know I need help, but I think I can figure it out on my own, or I just need to push a little bit harder, which are good positive statements to have, right? Like, if we can do better, of course, but it's a very strong rejection of help, as if we didn't need it, and the assumption that it's like, this is kind of the message I hear a lot, like, I'm not that broken, like, it, or that you have to have this horrible thing happen or be super burned out, if you can even recognize it, to even consider it, and even then it's you resist it some. So I think we need to figure that out, because I know that those of us who've been practicing coaching on both sides, because and I have a similar experience. I hired my first coach, I think it was around that same time. I want to say it's been close to 10 years as well. And I did it kind of blindly. Like, I to be honest, I didn't really understand what that was. And I've shared that I even had a little bit of a chip on my shoulder about it, of like, what's that thing about coaching? Those are therapists want to be, and they don't know what they're doing, and they're going to hurt people talking about trauma. And boy, was I wrong. Right. And there's good and bad people in every profession. And I hired the first one at a tough time in my life, that, like, I knew enough to know that I didn't need to see a psychiatrist. I knew that therapy would help, but I also wanted to be more, like, to get more efficient and more productive, and but then also feel better. Like, I felt a little bit lost inside. And I had a friend who had coaching, and she said, I'm doing this thing coaching, and I just kind of blindly signed up for the same person, and it totally changed my life, not just because of the help that she provided, but I was lucky that my first coach was a psychotherapist, and she was a beautiful example of how you can hold space for both professions, and still the mental health training can give you extra tools that overlap with coaching while still keeping the boundary. So I feel like I was very fortunate with that. And we've both, Erin and I have both been fierce advocates for coaching everyone that we meet. And I think that we need to continue that job of normalizing coaching as a way to feel better overall, be better individuals, better doctors, and yes, to prevent burnout, and but then also have a overall better well-being and a more fulfilling life. I know it sounds cheesy, but that's all the benefits that we see in coaching so strongly.
Right. Well, and I think as we talk about, can we normalize it? What if it was, well, we'll only get this athlete a coach if they really need it, if they're really falling apart,
Mhm.
as opposed to the standard. And in medicine, we are so resistant. And I'm saying we because I've practiced medicine. I was a very stubborn, hard-headed, resistant to help women in medicine for decades, 2 decades. And I also had a coach. My first coach was also had been a psychotherapist and then became a coach. And so I also hear that even though we went into it blindly, we just happened to get really good coaches that were great matches for us, which doesn't always happen. And yet I'm very grateful because, as you said, my whole life changed. And I think of the when I put into my Claude AI, what happened in the 12 months after I hired my first coach. Claude AI named it my crucible year. That's how many catastrophic events happened, including getting diagnosed with breast cancer 3 months later, dealing with my mom's, failing health with Alzheimer's, my mom almost dying, my grandma dying. I mean, it was an intense year. And I think, how would I have managed even one of those, like my breast cancer, had I not had my coach to support me? Had I just said, "Well, I'm still standing, I guess I can keep doing it on my own." I think, like, what it would have just been completely night and day. And so, can we start normalizing? And I think having access to a mental health provider helps too. They're both tools and resources that are very underutilized. And sometimes one is more helpful than the other. And a lot of people might need both, a therapist and a coach, because they can sometimes get similar outcomes, but with two different journeys. And again, if you're using one tool and it's not working, try another one. And I wish that coaching was a tool that was used routinely in medicine, because I'll share in a bit just about what the research is showing, and yet it seems to keep getting ignored.
Absolutely. And you read my mind, because I was thinking, how can we help physicians hear the message differently? And because yes, a lot of us are stubborn, and we are trained to look at evidence-based medicine. Let's think about it like the same way. Like, what are some updates in the research that we know of coaching in general, and specifically physician coaching?
Well, I did another query on the research, because one of the articles that I quote frequently is from, I think, 2017, and is when that study started. And since then, there's been multiple studies showing the benefits specifically for coaching in medicine. And so there is a randomized trial with a small group coaching, produced 29.6 absolute reduction in burnout rates. And then a 2023 systematic review of 14 studies with over 1,000 physician participants found that coaching was effective across every quantitative outcome measured. So that's one batch of information. There's a couple others I'd like to mention. There's a program that was created at the University of Colorado with 2 physician coaches, was specifically designed for women physician residents, and it produced statistically significant reductions in emotional exhaustion and imposter syndrome with improved self-compassion scores. And then that program has been adopted across the nation by 20 different health systems. And then there's a randomized trial in 2024 by Kaiser et al. Involving 138 physicians, finding significant improvements in burnout, professional fulfillment, and work engagement after just 3 months of coaching. And I know the other study that I was quoting from the late 2010s was talking about a 6-month program, and I believe it was just once a month for 6 months, showing improvement in well-being and decreases in burnout. And this one showed improvement in just three months. And so the body of evidence is mounting. And when I look at the negative impact that the absence of the right support fuels, so the more burnout there is, the more turnover we're going to have, more people are leaving their positions, either looking for a different job that might be a better fit or leaving medicine altogether. And if we improve things like decreasing burnout and we improve well-being, it's been shown to decrease the turnover. And when we think about the people in your organization that might have turned over, it doesn't just affect that one person, it affects the entire organization on so many levels. And to me, I just think of the ripple effect. One study talked about if we could have, I think it was 40,000 physicians stay in practice for just 2 years longer, it would fill this huge physician shortage gap. And I know people who've stayed in positions for 2 years longer who have been my coaching clients that were actively looking for other positions that stayed after we began working together. And I'm sure I wasn't the only reason they stayed, but when nobody else in their program was getting coached and they're the only one that stayed as long as they did, I would bet that that had a lot to do with it, giving them the skills, the support, and the strategies that help them not only with the individual issues, but also advocating for the organization to make changes that would better support them as a physician or healthcare provider.
That's like my brain is spinning with information, because I took some notes. I'm gonna read them back, because these are some of the words that we hear and we kind of ignore, or we're like, oh, it's not that bad, or no, that's not me, right? But I'm gonna repeat them just so that you hear them and see if they touch you, right? Like all these parts that the research found of emotional exhaustion, imposter syndrome, self-compassion, burnout, of course. And these are more like my paraphrasing of what you said, but the professional and personal fulfillment, self-valuation, mental and emotional well-being, and sense of control, right? Like even if one or two of those things, if you were to rate yourself from 1 to 10 in some of these things, when it's you start giving yourself lower numbers, we need to pay attention to that so that it's not, we don't see it as an all or nothing. It's like, okay, where am I struggling? What's a challenge here? Where could I be better? And think about how can coaching be helpful, and how can I show up better overall for myself, for my family, for my patients, if the scale was a little bit better in most of these areas. So I just wanted to kind of uh, highlight what you were saying, Erin. Thank you. And you mentioned it also in terms of longevity in our field, and right, like this is the biggest exodus of doctors that, right, like in the history of medicine, and that's right, like I'm not making that up, like we've read this. And if we think about it, because so many of us have been employed physicians, let's talk about that, like the cost for organizations if they don't invest, and what's maybe helpful language that as an individual you can use to also advocate for coaching if you were to be talking to the institution. So maybe kind of looking at it in both sides.
Okay. First, I want to highlight, as you were highlighting about the exodus of physicians. So, a recent finding came out showing that women were leaving medicine at an average age, I believe it was 48 or 49. I think it was 49, versus men leaving medicine at an average age of 64. And so you can see that that's a significant difference in age. And we've talked before about the many barriers for women being successful in men that are, or being successful in medicine that are different than men, such as how long we spend in the electronic health record, how longer hours at work increase our divorce rates. So there's, that's a different topic, but just want to point out that, 49 is pretty early to be leaving medicine, when you
Mhm.
think of how many years that were invested in getting there. And so when we look at, many businesses talk about ROI, return on investment. I didn't really learn too much about that term until I started running my own business. So as a physician, it's about what are you investing versus what do you get back? So thinking about like your 401k, what's your rate of return? If you put in $1 and you got back $7, I'd say that's a pretty good return on investment. And so when you look at the business models for coaching, and let me just pull up this stat again. Um, Business and executive coaching shows multiple credible studies demonstrating an average financial return of 5 to 7 times the initial investment. So, um, and sometimes even higher when looking at productivity gains and reduced employee turnover. So, not specific to medicine, but business and executive coaching. And so, when you look at physician costs, and I've seen numbers anywhere from at least $500,000 to replace a physician to $1 million and higher, and depending on the specialty, et cetera. And some research would say that physician turnover costs in the US healthcare system are $4.6 billion every year. And that an increase, 1 point increase on the emotional exhaustion scale is linked with a 7% increase in suicidal ideation and a 5 to 6% increase in major medical errors. That's not insignificant. And so when we think of what if instead of a $500,000 to $1 million loss at a minimum, when a physician leaves your organization, and think about your organization. Have you lost a doctor in the last year or two? For some places, they've lost a lot more than one. And what if then there was investment spent on prevention prevention strategies, intervention as an ongoing thing, like during your work hours, you're supported in these ways because many of the clients that I coach are doing sessions in the evening, on the weekends, right outside of their work. One corporate client, they actually did the group coaching sessions during the workday, which I was so pleased about. But for overworked physicians, they might think, oh, one more thing for me to do, versus an organization that says, we're going to have this on our time that you get to invest in this resource. And so when we look at the cost, it's not free to have coaching. Well, there's free resources out there, but for the most part, there's an investment. But the question I always ask is, what's the cost of not doing it? Whether this is for you as an individual or for your organization, how much longer are we going to have this unwritten financial line item, which is the cost of losing one more physician or one more healthcare provider on your team, because we're not investing in the factors that are going to have increased retention. And if somebody's thinking, well, but my organization needs to change, right? There's all of these organizational changes. Absolutely. Organizations, corporate medicine, employers, there's so many things that they need to do to make medicine more feasible to practice. And at the same time, even before those changes happen, even if those changes are slow, even if they haven't come yet, Joanne and I can both attest to, you can have significantly different outcomes, even as the individual, simply by focusing on what is under your control, what you have agency over, making different choices, and then getting different outcomes that are more in your favor.
Yes, and I'm glad that things are changing and it's a little bit more open now and that we have more data. Because I remember this must have been like 5 years ago that I joined forces with another physician coach, Trina Dora. We worked at the same institution and we created this. I'm going to pat myself in the back, like in hers, pretty good group coaching program. And it was going to be at no financial cost for the physicians, and we were going to get like an administrative fee for our time. And I say financial because, of course, there's the investment of time and energy, mentally and emotionally, that when we sign up, of course, with great return in investment. And I've shared this before, we had the hardest time getting a like buy-in from the administration in the value of coaching. And that's what we ended up saying, like, like, how many physicians have left? And are you just going to call them problem physicians, or are you going to take a little bit of responsibility for for why they left, and look at where they went to as well? And then, of course, we also use, which is a completely different topic that we've shared in this episode as well, then we also share the data on not just burnout, but depression, anxiety, and suicide, and that conversation of what's that cost as well, right? And that's another big topic that we can get back to in another episode again. But those are the things that we can think of individually, either you making your own decision of investment, or a lot of organizations, right? Like you can use your CME money to pay for coaching, for at least for certain programs. But then also, if you're an advocate and you want to be a pioneer and start a movement in your organization, and know this language to get your administration on board, right? And it's true, like, it's okay, right? Like, we can think of influence, if it's okay to think of what's in it for them. Like, that's an important conversation, and understand that, right? Like, at the end of the day, it's a business, and how does it make sense to them in terms of numbers, but then also the quadruple aim that we talked about, that, right? Like, it doesn't, it's, also the, not just the patient outcomes and all of that, but then also the emotional well-being of the physicians, and bringing all that into play. And again, thank you, Erin, for bringing up the research, because this is data. This is not just like a cute thing to do on the side. Like, I've been accused of like, oh, that's cute because you're a psychiatrist and you like all that personal development stuff. Like, no, this literally changes lives and saves lives, and can keep an organization going and improve patient care, right? All these things that we know. And obviously you can hear our passion about it, because we both believe in it so firmly.
Yeah. And you had mentioned about how can an individual influence or make an impact if there is no coaching in their organization. And again, for me, I didn't wait for my organization to pay for it. I didn't even wait for the research to come out. But for some people who would like to see that happen, I've had physician coaches that I know get it so their hospital system allowed CME money to be directed towards coaching. There's some different platforms that can give you self-directed CME credits. There's a platform called Learner Plus that you can pay an annual fee, and then the learning that you do, you put it into their AI program and it gives you CME credits. So there's some different ways that you can get that. Uh, so that financial burden may not be completely on you. And at the same time, the AMA has a calculator that your organization can plug in the numbers for their turnover rates and for what it costs them for physicians. I know I use this when I'm talking to corporate programs about this is why hiring me to help your program would be way cheaper than you losing one more, even, PA, NP, or physician. And so there's a calculator that they can use to put in their specific numbers to get an idea of what they are losing if they're not already calculating that, because sometimes then that makes the case that if you invest in this other system, it may be a much better return on investment than losing one more provider.
Yes, no, I love that. That's so smart. Yes, and I hope that this conversation is adding some hope and curiosity. And both Erin and I do one-on-one coaching and group coaching. So of course, we're resources amongst many other resources. So don't if you have any curiosity, please reach out because there are things that we can do. Erin, do you have like one thing that we haven't talked about that you would like to add about this topic, and or maybe even bringing it back to the athletes?
Well, I think that I'm thinking of a couple clients in particular where they were doing all the typical things. They were seeing a therapist, they were seeing a psychiatrist, they were seeing, do I need to be on medications? They were seeing their primary care doctor. Maybe they had changed their work schedule so that they weren't working in as many hours, and they were still just in this dark place. And one of the things I love about coaching is that it's very future oriented. Again, you make a different decision, you're going to get a different outcome. And so, can we get clear on where do we want to go? And then make more and more choices that are in alignment with that direction instead of randomly allowing everybody else in your universe to make those decisions for you. And so when I've seen them trying all these things that are traditional and they're still not getting the change, and then within one client was three short hours. And I'm like, man, how many sessions have we had? You're in a different place. And I look at the calendar, and there was one session where I got to know them. And then the other two sessions where we started working on things, and they just showed up. I didn't hardly recognize them in such a short time. So it's not a magic cure-all for everyone. And yet can sometimes be the little extra ingredient in the recipe that someone needs to get out of the rut that they've been in for weeks, months, years. I know for me, it was 2 decades that I was in the same stuck rut. And within 6 weeks of working with my first coach, I broke habits that I'd had for 2 decades, getting home way too late. And I started getting home around 6 to 6:30 every night when the norm had been 7, 8, 9, 10, 11 at night. And
Yes.
that was 6 short weeks. And so it's just very I found it for me very helpful in clarifying what I wanted, not just expressing what I didn't want, and then allowing me and giving me the support I needed, and the tools and resources to then start getting closer and closer to what I did want, instead of just not knowing how to get out of a situation where I knew that I didn't
Yeah.
want more of the same.
And those are great examples. And I always, maybe with my psychiatry hat on, always like to clarify, coaching is not meant to substitute if you do need psychiatric care or very specific psychotherapy, but you don't have to choose either. Like I have a lot of one-on-one clients who have their own psychiatrist. Like I don't play both hats at once. Those boundaries are clear. They have their own psychiatrist and they still see me as their coach. And I try to, and maybe because of I can do all three aspects of it. Like I try to know what's going on so I can use more specific coaching tools, and the feedback I get is what you're saying, like the help that they get in terms of their very specific mental health brings them up to a certain point, and then the coaching is what kind of elevates from there and pushes them forward, especially when the mental health aspect is a little bit better. So again, my psychiatry hat always wants to clarify that, and that's a question that I get a lot, but it's such important, all of it. And I think one of the main messages that we always want to leave you all with is that it's okay to not be okay, and that help is available, and always raise your hand. We're not here to be struggling in silence. So these are the conversations that we need to have more of. And that's why Erin and I show up to this podcast for you all on a regular basis, because we believe in all this work and the difference that it can make. So, and with that, I'm going to ask for help. And if you haven't yet, please give us an honest rating and review. So if you're listening on Apple Podcasts, you can go to show, scroll down, and then you'll see the little stars and a place to leave a comment. That's how we can reach more people, and then also learn more of what you all want to hear more of. And with that, stay tuned, because our next episode is coming right up.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.